Imagine being in the prime of your life and being handed a stage 4 terminal lung cancer diagnosis. That's exactly what happened to Adrian, a 47-year-old man living and enjoying his life. When he was diagnosed, the cancer had spread to his bones and invaded his lymph nodes. There was no coming back from this diagnosis. Adrian took smoking for granted, and he certainly didn't think it would kill him. What happened to Adrian continues to happen over and over again in the United States, around the globe, and in our community. Tobacco use is an epidemic and one of the biggest public health threats facing the world. Each year in the United States, 1 in 5 deaths is attributed to cigarette smoking, and tobacco use kills up to 50% of its users. What makes these figures more distressing is that tobacco use is the single most preventable cause of death in this country. There is no upside to tobacco use, as it's associated with multiple forms of cancer, heart disease, and lung disease, just to name a few of the negative health outcomes. The economic impact of tobacco is staggering, with smoking-related illnesses costing the U.S. more than $300 billion annually. This paints a pretty ugly picture, doesn't it? This is why we've formed a community coalition to do something about it. Each of our members brings unique perspectives and skill sets to the table to address tobacco use in our community through a multifocal lens. Together, we will drive policy change that is informed by the unique needs of our community. We will create synergy to change lives and improve the health and well-being of all community members by recognizing and reducing tobacco-related disparities and advancing health equity. Our coalition has a three-pronged approach to our shared goals of tobacco control and prevention, which include preventing initiation among youth and adolescents, promoting tobacco cessation across the community, identifying and eliminating tobacco-related disparities. When you join our coalition, you'll become part of an alliance of diverse leaders from across the community who are committed to improving the long-term health and well-being of our residents. Come meet the team. We have school administrators, teachers, and student leaders, faith-based organizations, leaders representing marginalized members of our LGBTQ, Black, Latinx, and Asian American and Pacific Islander communities, leaders from local public health, healthcare partners including hospitals, health systems, clinicians, and health insurers, local retailers, members of law enforcement committed to community policing, and members of the media, including TV, online, newspaper, and radio organizations. We hope you'll consider joining us in our fight against tobacco use. Thank you.